The data makes clear a little bit of self-advocacy can often improve health outcomes, and it's never been more important to take charge of your medical care and be a fully informed patient. Joining us now to discuss is WSJ Informed Patient columnist Laura Landro. Laura, first off, you're moving on and we're going to miss you, so congratulations. Yes. But you do leave your fans with some parting advice.
Yes.
You've been writing the Informed Patient column since 2002, correct?
Right, exactly.
How has outpatient care improved since then?
Well, I think a lot of the data is showing that some things actually have improved. There's been a slight increase in the number of people, maybe from 36% to 42%, getting recommended treatments like statins to prevent stroke and different beta blockers for heart failure. But actually, the improvements are not that great in the whole, and that's a little on the sad side. You know, there have been real efforts to make things safer, to have higher quality care, but it's like an ongoing battle in healthcare.
All of this is why we need your advice more than ever. And you say, first off, be sure to do your homework, correct?
Right. I mean, look, everybody knows there's a lot of snake oil on the internet. A lot of doctors groan when they have somebody come in with a stack of papers that I read this on the internet. But there's a lot of really reputable sites that you can go to, academic medical centers, federal government centers, researchers that are doing research in your disease. You need to be as on top of all of this as you can.
And also you say it's important to disclose everything. Do a lot of patients hold things back out of embarrassment?
Well, yes, because, I mean, you don't want to tell your doctor, you know, oh, yes, I use a lot of recreational drugs, or I've had multiple sexual partners,
right.
Or the one thing many people don't tell, as we've discussed in the past, is they don't tell them all these supplements they're taking. And, of course, we know those can interact with drugs. So you may be endangering yourself, but you haven't told your doctor, so they can't provide the right counsel and treatment.
Right. So you need to make sure that you reveal those things that pertain to your health,
right.
Or that can affect your health.
Exactly.
Now, what about questioning your diagnosis? I'm always a little wary of doing this because I'm afraid it's going to set up an antagonistic relationship.
Right. Well, unfortunately, again, the data shows that diagnostic error is very common in this country, and maybe some studies have shown as many as 1 in 12 adults will at some point have a diagnostic error. Now, some of that is not just that the doctor can't figure out what happened, but that something was missed along the line. But basically, you have to really go in there in the limited time you have, having done your homework, and really make sure they know all of your symptoms. Is there a family history of this? You're going to have to really push the information to your doctor, and perhaps even leave him with, you know, a list of things. And of course, you can always ask for a second opinion. You should never be afraid to do that.
You can, and
yes.
And will that annoy your doctor, though, if you ask for a second opinion?
No, I think, honestly, this has become so common. A lot of major medical societies and groups now offer this. You know, Cleveland Clinic and Johns Hopkins do this as a business. They have second opinions.
Right,
services,
right.
so.
All right. And you say also remember that no news is not necessarily good news. If you don't get those results,
right.
Make sure to pick up the phone and ask about them, right?
Exactly, because again, even with electronic medical records, so many things fall through the cracks. Mm-hmm. You know, yeah. Doctors get alert fatigue. They get so many alerts, even if it says abnormal test result, they might say, and then they'll go on to something else.
Which also goes to your other point. You've got to keep
right.
on track of your own records. You've
exactly.
got to keep copies of all your own medical records, correct?
Exactly, and you should have them with you in some format. You know, I mean, you end up in an emergency room or a hospital. And also your family history, you should really know it. You know, there's a lot going on now with genetic testing. We're going to be learning a lot more about things like this and what our risks are. But for now, you really just need to be able to say, here are my immunizations, here are the surgeries I've had, here's the drugs I'm on. That's pretty basic information that you should have with you at all times.
Have it committed to memory if necessary. Laura Landro, thank you so much for that. Such a pleasure. And we'll see you back here when you do your freelance piece.
Every now and then.
We're
yes,
very excited. Thank you. Thanks.